The nose is a really complicated organ and it has a lot of parts, but when we think of a broken nose, most people are referring only to the nasal bones on the bridge of their nose, over here. The structure of the nose is defined by these nasal bones, but many nasal cartilages and the nasal septum, and injury to any of these structures can result in fractures not identified on a simple X-ray. The septum divides the right and left side of your nasal cavity. It starts at the tip of your nose and extends straight back an average of 6 centimeters. That's all the way back to your ears. Direct trauma to the bridge of the nose may transmit force to break the septum inside, while the outside looks perfectly normal. This is called a deviated septum and remains one of the most common causes of blocked nasal and sinus ventilation. The nasal bones themselves are the hard bones at the bridge of your nose. The squishy tip of the nose is the part you can move around that's made of cartilage and can't be seen on X-ray. So injury to this part of the nose may cause weakness of the ligaments and internal collapse. This is best evaluated by a specialist and can be seen on 3D CAT scans if you know how to look for it. Patients with this type of injury usually complain that their breathing improves when they pull on their cheek or wear breathe right nasal strips. And to make matters more complicated, the effects may not be immediate. I tell my patients the nose can compensate, but it has to work harder after an injury, and this may cause things to worsen over time. Most patients report symptoms of a stuffy nose, trouble breathing during sleep, or sinus problems that seem to start out of the blue or gradually become more noticeable, even years after a missed nasal fracture or injury. If you have breathing or sinus difficulties after nasal trauma, even years later, it is best to seek the opinion of a nasal specialist, regardless of whether your external nose appears crooked or straight.